Thank you very much, Rimi. Good morning, good afternoon, good evening, everyone. Can you hear me?
You very well, loud and clear. We can even see you standing there.
Okay. Yes, so I'm very happy on behalf of our group here to share with you some experience on COVID-19 in Vietnam, because Jimmy keeps saying that Vietnam is a good country to fight avian influenza and in the past, and now the COVID-19. But for some of you, they are not familiar with Vietnam. It is the size of the country, about 100 million people. So this is quite big. And Vietnam is now a low middle income country in terms of classification was the World Bank, but it's a very tiny country, only about 330,000 square meters. We are very close to China, where COVID-19 started. That is very important information. That's why people talk about Vietnam, because we don't have many cases more. Okay, here I want to tell you a bit about the timeline of coronavirus in Vietnam. So we had a first case about 1 month after the outbreak started in Wuhan, China. But you can see that we have about 1 to 10 cases a day from time to time until now. And after 2 months, Vietnam had a lockdown for 2 weeks because the number of cases increased at that time. But after 3 weeks, the country opened again, people come back to work, and the strong recommendation is to practice the social distancing in the country. We were very happy to have 100 days without any community transmission case. And afterwards, it started again 4 days ago, where we found new cases in the community in Da Nang, at the center of Vietnam, and today we have about 8 cases in Ho Chi Minh City and Hanoi and Da Nang. So you see, next slide please. Altogether, you can see here that Vietnam has only until now less than 500 cases, with 90 cases under treatment in hospital, and the record of 0 deaths is still kept until now. You see, so if you compare with 17 million people worldwide infected, 370,000 people die already by coronavirus, of course, this is very good case. And if you look at the number of people are in isolation now, that is very big. It's 13,000. And these 13,000 people are placed in centralized center. Very often in military camps, you see, university dormitory, etc. But you have also about 3,400 people are quarantined at home. And that is actually the map showing you the red dot is basically the place where you have coronavirus case in the country. So it's not yet all in all provinces, but it's very much concentrated in big cities where you have a lot of flight and travels and immigration station, etc., etc. So that is the number in Vietnam. Next one, please. So now you see this slide maybe is interesting for you to understand the systems, how Vietnam managed coronavirus so well. And some of this experience is perceived as a little bit too aggressive, or doesn't really respect a lot of privacy from a Western perspective. You have a lot of F here, F0, F1, F2, F3, F5, and this is very essential concept in Vietnam. F0, it means that people are truly infected with coronavirus. So all the people are infected with coronavirus are treated in hospital. They are treated in tropical disease hospital in different provinces, mainly in Hanoi and Ho Chi Minh City, and the treatment is free of charge. So the patients are there, they are taken care, they are cured, and they don't pay anything. Government pay everything for them, including foreigners. Recently, some foreigners, are treated and they pay by insurance, but in principle, you don't have to pay if you are sick by coronavirus. So the F1 is everyone who has been in close contact with F0. It means that you stay 2 meters from the patient, you shake hands, and you are from the same office, etc. So you are identified as F1, and every F1 people are invited to be isolated in the so-called centralized isolation center, like you see on the right-hand side, with this photo. This photo is basically an isolation center where you have people, where you have about 8 to 20 people living in the same room with 2 floors bed, in the military camps or in the university dormitory, and people stay there for 2 weeks, where they are nourished, they have food, they have masks, they are actually tested and taken care by medical people for 2 weeks for free. And at the end of 2 weeks, if you are tested negative to coronavirus, you can go home. You have to stay 1 more week in your house before really being free and come back to work. And all the cost of isolation and quarantine are paid by the government as well. So you can see that you see if you are infected or if you are not infected, but you are F1, you are close to the patient, you don't have to worry about these 2 weeks. And of course, you can say that okay, it's not so private, people have to live in the same room, etc. But that's the condition the government offer to these F1 people. And now all the F1 people also, all the Vietnamese coming back from other countries, automatically they are placed in this isolation center. All the expats, I'm thinking of Fred Unger, our friend is being stuck in Berlin. If Fred can come back now to Vietnam, Fred is invited to stay in this isolation center as well. But as expat, they have the option to stay in the hotel. Isolation is a hotel, but they have to pay the fee of this camp. The F2 actually is people who was close contact with F1, and all these F2 people have to be quarantined 2 weeks in their house. And also, the same, the government offers food for them during these 2 weeks. And at any time, F1 or F2 people become infected, the cycles will be identified in the same way. So, all these F1 become F0 and all the F2 become F1, etc. So this, you can see that there is a lot of resource that the government to put in existing. Sorry, I am a little bit long, but that is basically the most important thing Vietnam is applying to control this thing. The next one, please. So, in terms of money, of course, the government pay a lot of money for that. You can see here that Vietnam approved about 2.2 billion US dollar as the state budget for control COVID-19 at central level. And of course, at the provincial level, the local government have to pay also for that. And until now, Vietnam spent about 700 million US dollar to control coronavirus. And from the economic impact, there's a drop of about 10% for the first half year compared to last year, but that is actually very normal. I think that other countries even drop more. And one of the good things is, in fact, the government implemented a social support package of 2.6 billion US dollar. Basically, they give some of the money to the poor people, to the workers from factories that are closed during that time, and also for people who sacrificed a lot for the country, like who are invalids. My father, for example, when I talked to him, he was happy to receive about $50 for 3 months because he was back from the war. He benefited a bit from this support in the country. So people take care of that. Next one, please. So, but that money, just to give you an idea about the money, so the GDP of Vietnam is about 200 billion US dollar a year. And what the Vietnam approved for the budget to control COVID is about 2 billion. So these are less than 2%, 1.5% about GDP at the moment. Okay, so it leads to some reflection. You see, people talk a lot about the experience from Vietnam. So, on one hand, you can see that, we have been doing quite well because we have a very good commitment from the government and use so-called one health or multi-sectoral approach, because it involves the government, education, military, police, of course medical sectors. So all these sectors work very hard together. They have also a very timely, accurate, and transparent risk communication. Many people from outside ask the question: if Vietnam really high information? Because why no death until now? Why only less than 500 cases? But I think that for this COVID-19, the government is quite transparent up to now, and people know about the information. Sometimes too much because of the privacy question. Because if someone infected by coronavirus, so the person has to tell to medical people whom they meet what the person has been doing for the last 2 weeks, and an active surveillance system is good, timely response by closing school, etc., etc. And from another perspective, on the right hand side, you can see that Vietnam have a fast learning from China. That's why I think that's a decisive action, and timely was important. But also the last point on solidarity in the society and good compliance is quite good in Vietnam. You can see that the human things are seen more during the COVID time. For example, here one of the innovations is in fact a lot of rice ATM. It's not to distribute money, but ATM to distribute rice to the poor. Happening in different provinces in the country during this COVID time. Next one, please. So you see, but as Jimmy said, we were free for 100 days without cases, and now we have, we start having more cases, and people are prepared for that. And we cannot really, have a very good position for the situation for long when around you have a lot of problems. So I think that the perception is in fact the countermeasure perceived as a kind of aggressive, and we continue to do that. The question posed also is in fact how long Vietnam can apply the same measure to control COVID-19, because it's very much resource demanding, and now more cases coming. I don't know if we can continue doing like that. On the positive side, in fact, Vietnam is prepared to have a good diagnostic capacity that has been strengthened in the meanwhile. 66 center or labs affiliated by Ministry of Health to control COVID-19 in different provinces, so it was okay. And even from the One Health perspective, some animal health labs are prepared for that, but until now they are not used to analyze coronavirus. Last slide, we have responded to COVID-19 in regional office. So we have been in compliance with national regulation, also with ILRI regulation, by practicing social distancing, in the office. Today people wear masks because of the new case. Usually, we don't wear masks for the last few weeks, but we started from yesterday that people have to wear masks in the office because of the new case. And also, we rearrange the workstation so that people don't stay too close each to other. We provided all these sanitizers, disposable paper. We monitor also the temperature of staff when they come to work here, and we have also regular information session for staff here. For the field work, in the field in Vietnam and Cambodia, but now we put a little bit on hold because of the new cases. And we have some colleague partners, the ILRI task force of COVID-19. We have been back to work in April. Actually, but now we need to monitor very closely with the situation to decide how we do in Vietnam. But generally, we are very happy and to come back to work compared to our office at ILRI. So with that, I would like to thank you very much for that attention, and I hope that the experience from Vietnam can be shared with you and other office, so that we can manage better coronavirus and COVID-19.